Hello and welcome to my channel Magic of Medicine. Today we will read about X-ray elbow. So we will be discussing X-ray elbow in two parts. In first part we will read about normal anatomy of X-ray elbow, and in second part we will read the approach to X-ray elbow. So, talking about elbow joint, elbow is a complex synovial joint formed by articulations of humerus, radius, and the ulna. So, there are three joints here. First is radiohumeral joint, second is ulnohumeral joint, and third is radioulnar joint. Now, radiohumeral joint is between head of radius and capitellum of humerus, and ulnohumeral joint is between olecranon and coronoid process of ulna and trochlea of humerus. So remember, the humeral articulations are capitellum for radius and trochlea for ulna, C for R and trochlea for U for ulna. So capitellum articulates with radius and trochlea articulates with ulna. Now talking about radioulnar joint, it is articulation between radial head and radial notch of ulna. Head of radius articulates with radial notch of ulna. There's a notch here in the radial aspect of ulna which articulates with radius. Now in full flexion, what happens is the coronoid process is received by the coronoid fossa and the radial head is received by radial fossa on the anterior surface of humerus. In full extension, the olecranon process is received by olecranon fossa on the posterior aspect of humerus. So now, where are all these structures? So we will read in top to bottom manner. So coming from here, this is shaft of humerus. Now coming to the lateral aspect, this is lateral epicondylar ridge. This is lateral epicondyle. This is capitellum. And now this capitellum is articulating with head of radius. So this is head of this round structure is head of radius, and this is the neck of radius, and this is radial tuberosity. So we have considered one alignment of the radial aspect. Now we know all the structures on the radial side. Revising again, this is shaft of humerus. This is lateral condylar supraepicondylar ridge. This is lateral epicondyle. This is capitellum. This is head of radius. This is neck of radius. This is radial tuberosity. Now coming to the medial aspect. Again, this is shaft of humerus. This is medial supraepicondylar ridge. This is medial epicondyle, and this is trochlea. The trochlea is the part of humerus which is articulating with ulna. This is ulna and this is ulnar shaft. Now there are three fossa in elbow joint. Coming from radial aspect, again the same approach. First we will read about radial aspect and then the medial aspect. So here this is radial fossa. This occupies radius head when elbow is in full flexion. This is olecranon fossa. It is receiving olecranon process of ulna, and this is coronoid fossa which is receiving coronoid process of ulna. So these are the three fossa in humerus. Again, this is radial head, this is neck, this is tuberosity. And ulnar parts are, this is olecranon process, this is coronoid process, and this is radial notch. It makes radio-ulnar joint with head of radius. Now coming to the lateral aspect of the elbow joint. So again our approach will be from top to bottom. So here this is shaft of humerus, this is supraepicondylar ridge, this one, this is medial epicondyle, this is trochlea, and this is capitellum. This small thing is capitellum. This is radius and this is ulna. Now here this triangular structure is olecranon fossa, and the anterior small triangular structure is coronoid fossa. Olecranon fossa will occupy the olecranon process and coronoid fossa will occupy the coronoid process in humerus. This is olecranon process, the posteriormost aspect of the ulna. This is coronoid process. We know that there are two processes of ulna, the olecranon process posteriorly and the coronoid process anteriorly. This we know well now. This is radial head, this is neck, and this small bulge is radial tuberosity. So this is all about lateral anatomy of X-ray elbow. Thank you for watching the video. If you found the video useful, please like, share and subscribe.